Our next speaker is Dr. Sweta Sneha. Dr. Sneha is the founder and executive director of healthcare management and informatics and professor of information systems and security at Kennesaw State University. She's a strategic leader bringing 2 decades of experience in technology and healthcare to integrate digital healthcare, patient engagement, and effective delivery and practice designed to improve healthcare outcomes. She's the recipient of several accolades and recognitions, including Distinguished Service Awards, KSU Collaboration Award, NCWIT Rise IT Award, WIT Top Women in Technology, and WIT Honoree.
Dr. Sneha has published over 100 peer-reviewed research, delivered panel sessions, workshops, and keynotes. Dr. Sneha also serves as editorial steward and university ambassador for Blockchain in Healthcare Today, co-chairs Health IT at AMCIS and HICSS. She has a PhD in computer information systems from Georgia State University, Robinson College of Business, and a BS in computer science from University of Maryland, College Park. Prior to academia, she worked at PricewaterhouseCoopers in management consulting. Let us welcome Dr. Sneha.
Thank you. Oh my God, hearing about that from both of you, I don't think I've had an introduction that good in a while now. So thanks, guys. I'm really happy to be here and really happy to hear the story that Dr. Ali shared before I joined. And just, it's good to hear various journeys and how it all comes to fruition. Shall I share my presentation, Anika and Dalia?
Yeah.
Okay. I guess I'm gonna need you to give me control, I guess.
There should be a share screen button at the bottom.
And I can usually find, yeah. Okay. All right, there you go. Let me know if you can see my screen.
We can see your screen, but
not the presentation. Can you see it now?
No, oh yeah, we can see it now.
Okay. Okay, great. Okay, perfect. So I'm going to just give you a little bit of background on me and where I started, where I think I'm going, and then take questions. I would hate for this to be a monologue, so feel free to ask questions as we go along, or if you have questions at the end, definitely chime in. So just to give you a little bit of background on where I started and where I am and where I think I'm going. So I came to US right after my high school, almost 26 years back. And I remember walking into the Maryland campus, and if you have not visited it, it's one of the most prettiest campuses. I think it's right close to Washington, DC. It's right close to Baltimore. So it's in the middle of a lot of things. And it's a giant campus with beautiful lawns and gardens, and the whole campus comes to life in spring with cherry trees lined everywhere. And we have a big reflecting pool, so it's really pretty. And I had a great time learning as an undergrad in computer science. And I also, so while I was doing my undergrad in computer science, I actually also dabbled in business. So my other major was decision support systems from the business school at University of Maryland. And I really thought the combination of humanities and computing gave me that extra edge when it came to consulting, when I was working with PricewaterhouseCoopers. So when I was working with PricewaterhouseCoopers, it was mostly, so my headquarters was in Baltimore, but our clients are all over the map. And it's a great place to start if you're starting right off the college, because just the experience that you get moving from one client to the other and going with a strong PwC team was just phenomenal. So if I had stayed, for instance, with one organization, maybe would have been exposed to what that one organizational challenges are, what the one organizational aspirations are, and then yes, of course, you get to grow and learn with that. But with PwC, because I was part of the management consulting team, since I moved from one project to the other, it sometimes it would last for 3 months, sometimes it would last for 6 months or a year. But those exposures were very rich and transcended multiple different domains. So I would highly recommend, if you have the stomach for traveling and if you like it, to explore that option. I came to Atlanta to do my PhD in computer information systems from Georgia State at the Robinson College of Business. And again, I have always liked the combination of humanities and technology. And I think Dr. Ali alluded to that, because it's one thing to be really good with technology and to be able to apply it, but it gives you just that tremendous edge when you understand the context, the business problem, the service constraints, and everything else with people that comes with that, and to create a solution that's more attuned to the domain rather than a solution that's very intrinsic but may or may not work for the domain. My PhD was actually focused on healthcare and management and informatics, and it was funded by NSF. And I hate to throw acronyms, but NSF is the National Science Foundation. It funds some incredible research that goes on to support any progress or any innovations that happen in the sciences, in the large overarching umbrella of the pure sciences and the interdisciplinary fields as well. So this was way back. So I started my PhD way back in 2004, and that's the time when healthcare technology and healthcare informatics as a field was beginning to emerge. It was gathering interest. We were talking about it more often than not. So my research since then and my area of work since then has been focused on how health systems can be optimized to improve patient outcomes, to reduce redundancies in resource utilization, to improve how the business of healthcare works without compromising on outcomes. And now one of the big goals is to actually support our providers, because you've probably heard that a lot of our providers are burning out. And that just means that they work just incredible number of hours a day, and the ask on them is constantly increasing. So we want to be able to see how we can support them accomplish their tasks the best without asking too much of their time, which is already spoken for. And I'll talk a little bit more about the kind of work that we have done in that space. And then after I graduated from my PhD, I have been working with Kennesaw State University. So I've been at Kennesaw for almost 14 years now. And it's been a great journey to grow from an assistant professor on a tenure track to a full professor. It's a lot of hard work, but it's also been extremely fulfilling, especially because I was, I have been very fortunate to bring together the technical expertise coupled with business acumen and humanities to everything that I do, from research to consulting to a lot of board work and a lot of community work that I do. So it's been a great journey. one of the things that I was asked to do early on when I started working at Kennesaw was to represent KSU at the Atlanta Chamber. So Metro Atlanta Chamber of Commerce has multiple different areas of focus, and it looks at the growth opportunities. It looks at what we can do to support our community in terms of economic development, workforce development, and so on and so forth. So my area of emphasis with them was health IT. So I was working at the Health IT Leadership Council representing Kennesaw to figure out where the greatest strengths of Atlanta lie, or and then to figure out how we can support that. So health IT, this was back in 2009, and we realized that health IT was growing by more than a mile. And at that time, there were 4,700 plus jobs that were going unfilled by what academia was producing. And that is mostly because health informatics as a domain is really fairly new. So, we have all heard of a career in marketing, a career in computing, a career in biology, but health informatics sits at the intersection of multiple moving parts. So healthcare is, of course, one of the big aspects of it, but then there is this aspect of business, this aspect of data science, this aspect of management, and understanding the various constraints that come in an organization, understanding people. So it's at the intersection of so many moving parts, and the skill sets that were required for people to really thrive in that domain wasn't really built into a lot of the programs. So with that gap and with that need, we worked with some of the large healthcare companies, both providers and insurance companies and technology companies and pharmaceuticals and suppliers and so on and so forth, to create almost a laundry list of skills that they would like for their employees to have if they wanted to work with them in the large domain of healthcare management and informatics. And with that was born the Masters in Healthcare Management and Informatics, and that's it's an executive premium program. It's truly interdisciplinary. It sits in the College of Business, but it also has its roots across four other large colleges: College of Science and Math, Computer Science and Engineering, and the Wellstar School of Health Sciences. We also launched a consortium in healthcare management and informatics because early on, I realized that it was really, really important for the students in the program to actually be able to work with the industry on real world challenges, on things that are kind of not easy to solve. The solutions are not that obvious. And then to expose our students to those problems and be a liaison with the industry segment, and to come up with non-obvious solutions was important. And so with that, we launched the consortium in healthcare management and informatics, which is really a platform to engage the industry and our faculty and our students. And a lot of times it's interdisciplinary faculty and students, but it's also cuts across academic boundaries. So we have had partnerships with other academic institutions as we worked on projects and worked on answering non-trivial questions, or worked on blockchain and healthcare, or things that are emerging, to see how healthcare is going to be impacted by that. So among all of these things, one of the things that is extremely important to me is closing gender gap in STEM education and STEM workforce. So it's been a little over 2 decades since I've been in this field. so for 25 years. And when I started in the undergrad in computer science, my class had no more than 5 females in the whole computer science major. And that number has increased a little bit, but it's not increased to the point where we can close the gender gap. So what I mean by that is, if you look at the 21st century workforce, a lot of that is going to involve computing. A lot of that is going to involve looking at data. A lot of that is going to involve machine learning and AI. And you don't have to be working in the weeds and having your hands completely with the boots on the ground and be working as computer engineers. But you need to have an appreciation for that. And one of the things that because I'm super passionate about it, and I have actually felt the pinch of that almost all throughout my career, really, is that starting from middle school is when we start seeing this phenomena of a leaky pipeline. So what that means is so in elementary school, the girls and boys are no different. They don't think differently. They behave very similarly. The ingrained patterns of girls not being good in math or computer or engineering is not there. But starting from middle school, somehow those things start taking roots. And it's very unconscious. It's very much out in the horizon, but it begins to have an impact. And by the time they reach college, a lot of them don't believe that they have the right skills to succeed in that field. So with that, you already have a bunch of people who are just consciously not choosing to be in that space. And then on top of that, if you look at the journey, a lot of them will not see role models. A lot of them will not know how to reach out to people. So I work very, very closely with the Women in Technology platform and with the NCWIT, which is the National Center for Women in Technology. And these are platforms to create that ecosystem where we can support the girls really from classroom to boardroom, and to make sure that we don't lose really good talent along the way. If there's one thing that I would like to see change in the next 2 decades, would be a shift for more and more women, smart girls like you, to actually take roots in STEM and grow through leadership and take more leadership roles. If you look at the board positions that women hold in STEM organizations, it's pretty bleak. If you look at a C-suite percentage that women hold in STEM disciplines, it's again, that number is, if you look at the percentage, it was in single digits, and it may have risen to low double digits. And that number is still kind of frightening. So we need to make a move to shift the needle, so we have more and more women who are supported and who are able to thrive, not just survive. And again, feel free to ask questions as we move along. So this is just to give you an idea of the diversity of healthcare management and informatics research that happens on that I have been involved with, that is actually part of a lot of things that takes place in that field. So my research agenda fits, I wouldn't say cleanly, but fits on these 3 buckets. So it's, of course, the big area of analytics and technology. And I loved Dr. Ali's allusion to, I think, one of his early careers when he was working with Duke hospitals and consulting with them on the utilization of beds. That hasn't gone away, and I don't want to transgress too much, but if we look at the rural health situation in Georgia, if you ever have a chance to look at agricultural black belt in Georgia, and it's called the black belt because that was where the topsoil was black and it was just really fertile. So it's called the agricultural black belt for that reason. But that area in Georgia, it almost looks like time doesn't remember it. It's just lost in time. And a lot of the rural health crisis that has been taking place in those areas. And the health systems are running very weak. And with the closure of hospitals, because they have not been able to sustain themselves, the whole economy begins to crumble. So let me just talk a little bit about some of these buckets of research. So data analytics and technology, safety, quality, and interaction, and then of course the whole caveat of leadership in healthcare. So I'm just gonna pick one example from each one of these, and of course feel free to ask me questions if you want to talk about anything else. Let me talk about the fall detection system for aging patients, or actually let me talk about one of the patient safety models that we developed in partnership with one of the large physician insurance companies in Southeast. So that was designed to, let me backtrack. So this is a physician insurance company. They insure physicians, and their job is to ensure that their physicians don't end up into a lawsuit, and if they do, then they defend them. So their business is ensuring their physicians practice safe medicine, the patient outcomes are good, and their physicians stay out of trouble, really. So they say they had decades of data when things had gone wrong. So every time there is an adverse patient outcome, they had tons of data on that. So we combined a lot of data that they have at the far end of the stream with data on upstream, where you can actually begin to see what's happening with the patient early on. And the idea was to create a predictive model, almost that would tell the physicians as they're going on a certain path that there is a big chance of them ending into a lawsuit. There is a big chance, there's a big risk that this particular procedure is not going to have the best outcome, or there is risks associated with this particular patient performing this particular procedure at this particular place at this particular time with this particular team. So we wanted to create a patient safety model that will give cues to the physicians on the risk factors and also what they could do to reduce those risks. And that was, again, a whole lot of data crunching, and we created neural network models, and it was a project that involved, of course, the clients, and they had physicians in the team, and along with their team of data scientists. And then we worked with a team of faculty and students on that project. It was really fulfilling, and at the end of it, we did create a machine learning model based on neural networks. And the people who worked on that, the students who worked on that, they came from healthcare, they came from computer science, they came from engineering, and they all worked together on addressing this problem. The other that's moving more into profile and persona. So just changing gears and moving into another project that we had done. This was funded by Microsoft a while back, and this was to create an application, and an mHealth app for the aging diabetics in China. And creating an app is relatively easy. All of you can potentially do it. But it was important to ensure that we understand the profile, the persona, the constraints, the context of these people for who we were creating this application for. So understanding the population and their constraints and their challenges and the opportunities that exist with that population, and then creating an application that matches that maps very well to it. So oftentimes, if you look at the whole world of mHealth apps, there is a dime a dozen, there is 100 apps that are added to that domain almost every week. But also the same number of apps fall off the domain every week. So it's important to understand the profile and the persona of the population, and that gets into population management, population health management, and you probably have heard those terms thrown at you sometimes. But it's important to understand that population before you create a technology and superimpose it on that, because the adoption and usage of an application is what is going to drive outcomes, is what is going to drive improvements. But if it's not going to be used, then it's not going to have any improvements, despite of how much money you push in that direction. So it's very important to understand your population before you create a technology, because oftentimes you will end up creating something that makes sense to you, but it does make sense to the people who you're creating that technology for. So by the end of it, we had created a gamification app, and even the metaphor of that app came from that population. So it started out with, just to backtrack, to manage diabetic populations, there are 3 things you need to do. You need to make sure that they're managing their diet, medication, and exercise correctly. And remember, these are the aging diabetics. So you can't really ask them to run, you can't really ask them, so they have their own constraints. So the application had to give them visual cues without having to ask them for too much information. So it was a gamification app, and they gained points if they were doing well on those 3 factors. And if they were not doing well on those 3 factors, then they were given visual cues that they were not. And by the end of a month, when they went to see the physician could also look at the dashboard in a more intrinsic way and say that, well, 70% of the times you did not keep up with the medication, or 70% of the times you kept up with the medication, so kudos to you, or that you did not walk enough steps 90% of the time, so your results are not as good. And what the patient saw was a pagoda metaphor, and the pagoda was red in the morning, the sky was blue with white clouds. And as the day progressed, if they had been keeping up with their diet, exercise, and medication, everything would stay the same and they would gain points. Say, for instance, they missed medications that day and they missed their medications twice that day. The pagoda will begin to turn from red to brown to black and fall to the ground. So looking at that app, they would know, they would be given enough visual cues for them to know that they have not kept up with their medication. And also, if we could set up the threshold that if they didn't do it for 1 day or 2 days, that somebody in the caregiving team would be informed, so that help could get to them before it was too late. The other one that I would talk about is the leadership in healthcare. And that's also extremely important. So, there's one thing that you can understand data and technology, and you can create really cool apps, and you can come up with the most intrinsic machine learning algorithm. But it's another thing to actually take the learning from that and implement it in a business so that the business actually stays alive and kicking. So I'll give you an example of one of the local hospitals in the heart of Atlanta that was about to shut down. And one of the things that needed to happen, they realized quickly that one of the biggest problems that they have is associated with the loss of revenue, and also with the increase in expenses associated with their emergency room utilization. And like any good business, they would want to see where the biggest expenses are, right? So when the analysis was done, it was found that a population of people who were in a certain zip code, who had multiple chronic conditions, were also belonged to a certain economic condition. So you probably have heard of the term SDOH, which is the socio-demographic factors associated with health. And most of the recent research actually shows that that SDOH has become one of the biggest predictors of health outcomes. And that's almost sad. But we realized that that was a group of population, a group of patients living in a certain zip code that were costing them a lot. So that information came from data. That information came from analyzing tons of data and looking at correlations, looking at the whole ecosystem of factors that could predict that. But now the whole aspect of leadership and management comes in, where what are you going to do about it? Okay, so remember, this health system didn't have a lot of resources, so it's not like you can allocate 100 different nurses to then take care of these patients, go to their houses. You just can't do that. You don't have those kind of resources. So it was a very ingenious idea to come up with repurposing some of the existing vehicles that they had, because one of the biggest problem was that these were the people who would end up into ER more often because they were not taking care of themselves. And so they would fall very, very sick, and then they will end up into ER that was costing a lot of money. So if the thesis was, if they went for their regular checkups, they would stay out of ER and their outcomes would improve. So, with that thesis in mind, they repurposed some of their existing vehicles, the ambulances, which was lying idle for most part of the day. And that would create an efficient route to pick up these people from this zip code, take them for their primary care visits, and then bring them back home. It went on for over 6 months, and then data was looked at again. The outcomes had improved, the ER visits had decreased significantly. And there was a side effect to that they had built camaraderie within the group of people who were going across in the same route, and they were exchanging notes with each other to realize how they could improve outcomes and get better. I'm going to skip that because we did talk about it, and I want to make sure that we have time for questions. So these are some of our partners and collaborators that we have worked with on multiple different aspects of healthcare management and informatics. You will see that a big chunk of these are health systems, but then there are also a big chunk that are associated with insurances, that are associated with emerging technology. For instance, ShareCare. Have you heard of ShareCare? So ShareCare is a company that's actually in Atlanta. It was launched a little over a decade back by, have you heard of WebMD? And I'm asking these questions, but I can't hear any of you. But Jeff Arnold was the CEO of WebMD, and he launched ShareCare in Atlanta. And ShareCare, the whole idea, it's a technology company, but it's a platform. And the idea for ShareCare was to empower patients, put them at the center of care, and allow for the caregiving team to share the care of the patients. And then there is Synchrogenics, which is a pharmaceutical firm, and we worked with on a blockchain and healthcare solution with them. And then there's Splunk, and there are many others. So, and of course, there are consulting firms as well. And each of these, there are many consulting firms that have very strong healthcare practices, and it's great. It's a great opportunity to start your career with them, just to get a very wide focus early on for you to see whether or not you like that space, or what you like or not. So these are some of the areas that you may be interested in, or, so if you want to pursue an undergrad in analytics or technology or information systems or infrastructure, or this is not an all exhaustive list, or engineering or computer science. And some of these areas are evolving as we speak. So there are a lot of interdisciplinary domains that are coming up, where you can come from a liberal arts background, and have a very, very high level understanding of the context, and then go deeper with technology in one of the areas. Multiple options for graduate college, and of course, PhD if you want to pursue that. And Dr. Ali is right, it's a long haul. It can get very frustrating. So don't take it on if you're not sure about it. So this is a very powerful report. The Institute of Management, the IOM report in 1999, was one of the seminal reports that actually pushed technology in healthcare. So this was a report that came out that essentially said that there were almost 100,000 deaths at that time that was happening in US, and that were caused by preventable medical errors. And that when it came out, it was in the order of ranking, it was the third largest causes of death. So there was essentially a bigger chance of somebody dying in a hospital, not because of any normal causes, but because of preventable medical errors, versus dying on a road accident. And we all know how bad the road accident numbers are. So that was pretty bleak. And that actually propelled the federal government and propelled a lot of policies, and that's how the electronic prescriptions were born. So the idea was that a lot of times when prescriptions are written, they're illegible, and you don't really know the strength of the dosage, the time of the dosage, and you can miss the person that, you can basically mix a lot of things, and errors have happened in that space. So, with e-prescriptions, we would get rid of illegible handwriting. We would know exactly which patient to give what medication at what time. And, we moved towards barcoding. So a lot of times when you go to the hospitals, you would see patients wearing a tag which has a barcode, and the nurse will match the barcode to the drugs, and then they will be able to administer the drug knowing the right dosage. And yet there are lots of room for improvement. We launched the electronic health record with that thesis that having an electronic health record that is going to be more holistic than paper records, which may or may not have the life, and which may not really have visibility to the entire care team, would be more amenable to giving patients better outcomes, and for us to reduce the cost. Because the other challenge was the increasing cost in healthcare. So healthcare in US is it's sitting at almost 20% of the GDP, which is a huge number. And if we continue on that path, we will not be able to sustain it. Medicare already is running out. It's been running in red for some time. And so it's extremely important to manage the business of medicine in a very lean way without compromising on outcomes. And it can be done, and we are on the path of making it happen. But we're taking early steps. And if any of you are interested in a field where you can impact healthcare without you having to be on the bedside, it's the right time to be in that space. So with that, I will open the floor for questions. And sorry, I have not been keeping track on the chat. So if there are questions in the chat, I haven't looked at it.
Hey guys, so if anyone has any questions for Dr. Sneha, you can post them in the chat or unmute your mics.
Well, I knew I could be crystal clear when I wanted to be. So if there are no questions, you can always reach out to me. Both Anika and Delia they have my information. So feel free to reach out to me. You can also connect with me on LinkedIn, and hopefully we can keep the conversation going.
So one question I got was, you kind of mentioned how humanities also connects to data science. And one of the things that I was kind of wondering is, I guess, what specific humanities areas or courses and things like that would kind of connect to, I guess, what you do in your field.
So, having background in business, for instance, is always helpful. So, because healthcare is actually a business. Yes, it's a service industry, so you're taking care of people, but at the end of the day, it's running as a business. So having a background in business is always helpful. I've had people who have done extremely well from liberal arts as well, and they've come to the graduate program and have done extremely well, because it's also important to be able to articulate. So when you're speaking to a diverse audience, sometimes some of the smartest people who are really good at math and stat and engineering, they become really good at working on their own or working in their small team. But it's important to be able to articulate your solutions and your problems and being able to share that vision with a diverse audience. So having a background in liberal arts, having a background in integrated health systems. So IHS is a field of study that's coming up from a lot of schools of nursing. So you don't really have to be a nurse on the bedside to be able to work in healthcare. So IHS is a field of study that basically allows you to have an understanding of healthcare and its various challenges without you having to be on bedside. And then you can graduate, or you make your way towards graduate school and then get more into informatics and analytics and data science. I don't know if that answered your question, Anika.
Yeah, for sure it did.
Okay.